Hello, St. Lucia and the rest of the world. Welcome to the National Television Network, the NTN, and the Government Information Service, the GIS. I am Lucia Joseph. At this time, we're beginning special reporting on COVID-19, the coronavirus that has gripped the world over. We will be with you throughout the day with special reports and speaking with various key members of the sectors that are working assiduously in protecting St. Lucia from COVID-19. To start off, we want to get to the results of the test conducted on Prime Minister, the Honorable Alan Chastanet. Last evening, the nation was informed that the Prime Minister had gone into self-quarantine following symptoms of feeling unwell. And the official result is that the Prime Minister has tested negative for the coronavirus. And the press statement coming out of the Department of Health and Wellness reads, on Tuesday, March 17, 2020, the Ministry of Health was informed that the Prime Minister, Honorable Alan Chastanet, was experiencing a mild cough following recent travel history to Miami for medical attention. And in abundance of caution, he had opted to place himself in voluntary quarantine. He contacted the Chief Medical Officer and a medical team was dispatched to assess the Prime Minister. A sample was taken for testing, which included testing for COVID-19. The sample was sent to the Caribbean Public Health Agency, CARPHA. The result was received late on the same day, that is March 17, and it is negative for COVID-19. The Honorable Prime Minister has been informed of his results and he is in stable condition and in very good spirits. Prior to receiving the results, the Ministry of Health had commenced the routine process of contact tracing. Some of the close Prime Minister's contacts also voluntarily placed themselves into quarantine as a precaution while they awaited the results. Along with the result, the Honorable Prime Minister, the Ministry of Health, also received other results for patients in isolation, and they are all negative. Once again, the patients in isolation, out of an abundance of caution, the test result for COVID-19 has proven all to be negative. And there shall be a comprehensive update in a statement to the media, which will be released later today by the Chief Medical Officer. And of course, you can stay tuned to the NTN GIS for that press statement. I'm also joined here today by my colleague Primus Hutchinson. Primus, good to see you on this early morning.
Thank you, Monsieur Lessa. Monsieur Madame, quand Lessa Deu, NTN GIS, cette fois-ci, qui a présenté nouvelle sur la situation maladie corona. Et nous avons ici durant la journée face au public pour avoir information qu'on y a venu nouvelles avec les autres monde nous avons une discussion à ce. Nous avons cette discussion nous avons tout à l'heure c'est puis organisation NEMO mais avant ça quand on lit de en anglais et moi de créole qui Premier ministre là mardi le 17 mars ministère de santé il a trouvé information qui Premier ministre là honorable Alan Chastanet a expliqué certains problèmes qui n'a été touché ça c'est après il a voyagé pour trouver assistant médical à pays Miami pour prendre toute précaution qui est nécessaire et te mettre en quarantaine inspection pour protection comme qui s'est posé fait les gens trouver en situation ça là il fait contact et puis chef officier médical ça c'est docteur Sharon Belmont George et groupe et qui a visité le Premier ministre là et qui a ça pour faire pour tester pour regarder si il y a un signe de maladie corona. Il y a agence CARPHA, ça c'est l'agence qui a la responsabilité pour santé publique à Caraïbes et il a trouvé un résultat même jour, le 17 mars, qui a montré que le Premier ministre n'a pas de maladie à pièce façon négative. On a le Premier ministre là, il a formé situation ça là et qu'à présent il y a des conditions qui stables avec un bon condition avec un bon esprit aussi Avant, il recevait résultat sur ça. Le ministre de la Santé a commencé aussi pour faire contact avec tout le monde qui était puis Premier ministre là, dans différents ça a été fait pour journée là. Et que tout ce monde qui était correctly durant ça là, ils ont aussi mis en quarantaine, en sélection, en façon des précautions pour trouver résultat, pour garder si eux même une pièce affectement. Et puis, résultat, on a le ministre de la Santé aussi vrai, c'est ça, information associée aux patients là qui étaient isolés, et toutes ces examinations ça la sortie négative. Les pièces de mon qui étaient bon pour le ministre là, de votre ça là, pas de maladie. Et que ça qui a fait, c'est ministre de la Santé qui a porté information totale à cette situation ça là pour les mêmes médias plus tard aujourd'hui ça a sorti chef officier médical à cette situation ça là. Lisa?
Thank you very much there, Primus. And as you know, we do have 2 positive cases in St. Lucia. Those were individuals who traveled to the island. And as such, numerous protocols have been put in place. Plans are being activated across the public sector as well as the private sector. We're now taking a report from Fiona Neptune of the Ministry of Health and Wellness, and she talks about the sort of preparation on the personal front.
As part of the measures to prepare for the possibility of a COVID-19 outbreak in St. Lucia, the Department of Health and Wellness wants to ensure that the public receive the necessary safety and readiness tips. Formerly life educator in the Bureau of Health Education, Naomi Grandison, encouraged St. Lucians to consider social distancing as a means of reducing the spread of COVID-19.
We are encouraging persons in the case of an outbreak to practice social distancing. And what this means is that you should avoid places where you're going to be in close contact with others, where there are many people, for instance, the gyms, the churches, even the supermarkets sometimes. Schools may be closed. So we basically are encouraging persons to do that, because if somebody is infected and they sneeze or they cough or they spit out in public, these droplets can rest on surfaces. You in turn can touch it and then touch your eyes, your nose or your mouth.
Grandison also called on St. Lucians to be prepared, aware and proactive to prevent the spread of COVID-19.
So we are advising the public to avoid panicking, but remember, preparation is key in the case of an outbreak. So for instance, you should stock up like in the case of preparing for a hurricane. So persons who are taking prescription medications, they should stock up on at least a month's supply of that. Have enough water, have enough food at home, have games for the children, stock up on masks and gloves in case somebody gets sick, because that's when you really need it. And any other items that come to mind. For instance, bleach would also be a very important one, hand sanitizer or rubbing alcohol. So just prepare, because panicking in itself can have a negative impact on your immunity.
The Department of Health and Wellness once again encourages St. Lucians to be prepared for the possible outbreak of COVID-19 and to avoid panic. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fiona Neptune.
That report, thank you so much. And of course, some of the advisories issued there will be able to flesh that out throughout the day as we continue live coverage. As I indicated, we will be going through right to the evening hours. We're joined now by the Director of the National Emergency Management Organization, Dorine Gustave. And for NEMO, this is a very, very critical time, because we often hear a lot about NEMO during the hurricane season. But as I indicated as well, COVID-19 is a pandemic that the world has never seen. Dorine, thank you so much for joining us and welcome. I'm sure for you at this time, you know, it's not unusual for NEMO to be at a sort of heightened pace, but certainly there is a sort of difference in how NEMO has to operate, because now we're not awaiting a pending storm or having to respond after a storm. We are literally in the storm.
Exactly. Thank you for having me, Lisa and Primus. Indeed, NEMO is ready to respond, and this is our mandate. We are mandated to be responsible for the country in a state of readiness in the event of a disaster. Now, this is, like you said, not a storm or hurricane or an earthquake, as we know NEMO is always called upon during that time. However, this being a pandemic, we are ready and we have put all of our mechanisms in place. We are working assiduously to ensure that the country is in a state of preparedness.
So what are those plans that we're talking about?
So we have already established for years now a national influenza plan. The national influenza plan is, has outlined everything that needs to be done in the event of a pandemic. Now, we know that COVID-19 has sort of different characteristics to a natural, to an influenza. So, with that being said, the plan has responses for all of the agencies of government that are involved. So NEMO, when we speak of NEMO, we are not speaking of the Secretariat, we're speaking of the wider body NEMO organization, which takes into consideration a number of other agencies, such as Ministry of Health, the Police, Fire, Ministry of Tourism, a number of other agencies that come together to form that body. So indeed, we are responsible for the coordination of all response actions before, during, and after a change of an alert level. So we realize that we are at level 1 right now, about to go into level 2, close to level 2, but we're treating it at level 2 already. And so we have started having our meetings with all of our stakeholders, of our national, we have our national agencies on board, the national committees, such as the Supplies Committee, the Welfare Committee. We have our district disaster committees who are working with us on the ground to ensure that the communities are in a state of preparedness, that the information is filtered down to them, and they are well aware of what they need to do in that instance. Yeah.
So did again, since this is like none other, so the disaster preparedness committees, how did your office prepare them to respond?
So the committees are always in contact with NEMO, and once the information gets to us, we pass on to them. So we have our group chat, we have their email addresses, we have one-on-one conversation with them, we have linked them with Ministry of Health, Bureau of Health Education, educators in the community, so they now are taking the lead in communities to ensure that this information is filtered down.
Okay. And did they require specific questions they may have? Because during a hurricane, you would find that some of the members of the committee would have to go house to house, checking on the elderly, those who are shut in, disabled people. How are they working around the communities?
And so the Ministry of Health, is working with the district disaster committees. So training will be done in the coming week. They will be assisting with the track tracing of persons who may have come into contact because they are on the community, they are at the community level. So there is the wider body of the district disaster committee, but there are subcommittees in communities that are linked directly to the committee. So in that way, the district disaster committee have eyes and ears on the ground in communities. In that way, the information that they passed on, the training in how to deal with contacting those persons has been planned. And so they will be able to assist the Ministry of Health in finding those persons, because they'll know who has traveled, who has been where, the community, who else, better placed than those persons from the community to assist in this.
Okay. And let's look at some of the laws that we have in place. You spoke about the influenza plan there, and that you activated that. What are some of the powers that NEMO would have to exercise at a time like this?
Okay, there is legislation in place to deal with a pandemic. The emergency powers, that's the Disaster Act number 5 of 1995, to make provision for welfare and safety of community in case of a hurricane, earthquake, fire, flood, or any other disaster. Now, the COVID-19 fall under that any other disaster. We're not saying that it is a disaster already, but once the level has elevated to a level 3, the national emergency system kicks in place, and then NEMO assist with the coordination of this event.
And we know that some countries, and in St. Lucia we're hearing about states of emergency, disaster areas being declared, and all of these have different meanings. Of course, depending on the territory, what their own interpretations are, but they also trigger certain actions to be taken by the government agencies, and a lot of that is the release of funds and so forth. In St. Lucia, let's look at, for example, when will a state of emergency be declared, and how would NEMO function?
Okay, so under the Disaster Management Act number 30 of 2006, it gives the guidelines, the power as to how the declaration of a disaster is done. So once there is in-country spread, community spread, this power is handed over, and we ensure that persons are safe and there is no further spread. We allow this to kick in to give the Prime Minister, who is head of NEMO, the authority to declare a disaster. Now, it happens in stages. It can be a shutdown that takes place. So the shutdown can be done in phases. So you can have a partial shutdown where essential services are allowed to operate. You can allow for supermarkets, banks, and so on to continue functioning for a short period of time. When it is no longer safe, then you have a total, or you can declare a state of emergency. So in that instance, all systems are asked to shut down.
All right, we're speaking there with the Director for the National Emergency Management Organization, NEMO, Dorine Gustave. We'll take a break right now. When we'll come back, we're going to sort of review all of that in Creole.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
Monsieur Tan, bienvenue encore à ce spécial programme Salah Kinouni sur NTN avec GIS. Bienvenue cette Lucia qui est les autres pays qui a gardé à présent. Nous avons fait un bilan ni anglais qu'à créole. Nous avons fait le directeur exécutif pour NEMO. Ça c'est une organisation qui est responsable pour toute affaire désastre à cette ici. Ça c'est Madame Dorine Gustave. Et que nous voulons bienvenue encore à ce mission à GIS NTN. Et pour dire nous, pour expliquer simplement la responsabilité de NEMO, particulièrement dans une situation comme ça.
Merci, Primus. Bon, NEMO est responsable pour mettre place là, préparer place là pour pièces qualité désastre.
Donc, il faut parler pays.
Il est responsable pour coordonner tout effort pour assurer tout le monde comprendre ce qu'il y a et que préparer pour responsabilité personnelle pour safety
pour protection. Mais qui est au niveau de ça qui est préparer le monde pour ces ça précaution qui est nécessaire qui ça niveau qu'a fait spécifiquement pour ça faire cette liste préparer quoi et comprendre ça qu'a fait.
Bon, NEMO travaille avec ça créé groupe désastre à des communes.
À différentes
communes. Yoni ça créé disaster committees. So c'est groupe ça là. Nous avons passé toute information dans le ministre Health à présent, yo qui est responsable pour manager ça kali. Information yo passé pour nous avons passé pour ce groupe ça là. Nous avons mis en contact avec ces ministre Health pour yo bayo éducation et information pour yo passer pour commune. So toute information qui yo joine yo ka passer pour commune yo ka essayer faire moun comprendre ça qui ka aller c'est yo qui ka travailler et puis NEMO à toutes ces communes ça là nous ka aussi volontaire nous yo pas ka faire pour payer yo ka faire
OK pour à présent est-ce que qui comme chef organisation ça là ou satisfait que travail là qu'a fait comme supposé fait avec ces groupes désastres là tout cette commune là est-ce satisfait que travail là qu'a fait manière supposé fait c'est son situation qui servi et on supposé comprendre sévérité problème ça là corona si cas est venu à dans plus mauvaise situation c'est groupe désastre là qui a passé pour parler avec ces gens je peux faire celui qui c'est bon pas en comprendre mais qu'à suivre direction qui est en place pour eux on sont satisfaits que ça a fait de façon
eh bien par exemple moi l'idée que après ça la plus sérieux par ce hurricane parce que il peut affecter n'importe monde mais dit tout le monde il pas ni regarde pour personne il peut affecter n'importe monde so il peut sérieux avec yo ka des questions yo brisé avec yo ka faire quand yo paye information yo ni donc qu'on savent personne est pas parfait c'est mon ça c'est mon qui ka travaille aussi yo ni famille aussi so yo ka manager à dans manière nous qui effective
d'accord nous après l'année c'était loi qui est en place pour gouverner opération NEMO les venir pour faire des as on s'abonne un petit information sur ça.
Oui, l'année loi en place avec depuis situation commencé loi a suivre loi ça. So l'année ça a créé National Influenza Plan. Il y a combien volume? So il a parlé pour l'année ça a créé un strategic plan. C'est ça qui a dit ça pour faire. L'année a communication strategy. C'est ça qui a dit qui manière pour communiquer information pour moun comprendre. Il y a ça pour ministre health, il y a pour agricole, il y a pour éducation, il y a pour national security, essential services, il y a pour gouvernement, wider gouvernement, tout travail, tout département gouvernement qui ça y est supposé faire. Et il y a pour transport secteur tout. L'année ça y a créé Quarantine Act là, et l'année Public Health Act. Toutes ces bagages ça a établi pour moun pour gérer moun.
Exagère en opération tout à présent.
L'année Disaster Management Act number 30 of 2006. Ça tout qui a pouvoir pour faire pour guider gouvernement qui manière pour faire certains bagages, qui manière yo kay fermer place là, qui ça yo kay suivre. So toutes ces bagages ça j'ai en place pour gouvernement just guider gouvernement.
Sans souhaiter situation maladie corona venir puisque à présent il pas grave comme il suppose grave. Là il a percevé il commence à simer nous pas assurer nous pas ça pas jamais dit pas fait en toute cette commune il va y avoir dans situation côté gouvernement pays pour double toute opération et ça peut faire à différents stages du document ça qu'a fait quel manière gouvernement a coordonné ça
so comment dire là il vient à sous level 3 côté il a commencé spread à la commune et bien place là parce que ça nous à présent c'est des monde qui viennent à place là yo pas je place là je pays yo vini avec nous yo confirmé mais là ici vini pour level 3 côté ka passer différents monde pour monde then gouvernement ni pour action vitement pour empêcher simer la famille commune et c'est là il est venu mauvais si manger en commune so ça gouvernement ni pour faire c'est pour la décision si il ferme place là à quel level il ferme place là parce il s'agit ça a créé partial shutdown avec à tout côté qui est fermé
mais si bah la vie grave
oui tout partout qui est fermé tout bagaille qui est debout mais nous avons prédit pas venir là c'est décision qui aide pour le gouvernement faire c'est puis nous apprécier ça parce que il a affecté tout bagaille qui a affecté monde qui a affecté économie éducation tout bagaille so c'est pas une décision gouvernement qui prend pièce gouvernement qui prend easy
Madame Gustave avant nous de discussion à quoi là qu'est-ce que conseil vous dit public là généralement qui est cette ici et l'autre pays aussi
je dis cette lycée avec cette lycée qui est l'autre pays ministre health ja mettez tout ça yo paye pour guider moun qui ça pour faire pas coûter différents bagaille moun pedi coûter ça ministre health ka di moun pour laver la main make sure ou laver la main bien ça yo ka créer social distancing tie pas rester près moun pour ça yo ka mettre différents mesures en place pour moun pas venir ensemble traiter tout le monde accordionné mais pas discriminer ou twete ko wakodoni pour protecter mounou. So là ni comme différents ti conseils qui j'ai mis en place par ministre health. C'est ça nous ka créer credible source là. Coûter yo parce que yo savent qui ça qui meilleur pour nous. Avec nous NEMO nous a préparer système mono pour si tous les cas nous peut venir à level free.
OK. Merci autant Madame Gustave de ka cause en Koyol et puis Madame Dorine Gustave qui directeur exécutif pour NEMO de qualité préparation organisation et plan qui est en place pour adresser la situation de maladie corona. Lisa?
Merci very much for that. And so we go back and ask Ms. Dorine Gustave to outline for us the influenza plan that is guiding NEMO at this time.
Okay, so the influenza plan is an 8-volume plan. It's extensive, but it is for all of the sectors that are involved. This plan has a strategic plan, that's volume 2. Volume 1 is the concept of operation, and the volume 2 is the strategic plan. Volume 3 is the national communication strategy. Volume 4, it has the information for the Ministry of Health as to how to operate. Volume 5, Ministry of Agriculture and Forestry and Fisheries. Volume 6 is Ministry of Education. Volume 7, Ministry of National Security. 8, Essential Services, and has for Government of St. Lucia Public Service, the entire public service, not the Ministry of the Public Service, but the entire public service. It has guidelines for the transport sector. There is also the Quarantine Act and the Public Health Act. This information is available on the NEMO website at nemo.gov.lc. There is a lot of information on that website, and I urge St. Lucians to please take time. I know a lot of us will have a lot of free time. Take time to familiarize yourself with the material that is on that website.
Okay. Yeah. And of course that information, the various steps that are being taken by these agencies.
That is right. And it has for any disaster, any information you need on NEMO is on that website.
Before we get to what the recommendation for the public is coming out of NEMO, let's just go back to some of the action plans that have been taken by NEMO.
Okay, so NEMO to date, the actions that we have taken, like I said, the information on the pandemic has been forwarded to the district disaster committees. The contact information of the Ministry of Health through the health educators, they have also been forwarded to the district disaster committees, which we call the DDCs, to assist with sensitization and ongoing community education. We have also gotten a stock level of emergency supplies by the local suppliers. A meeting of the National Suppliers Committee is slated for today, later today, March 18th. NEMO has also forwarded periodic situational report, what we call SITREPs, to SEDEMA. NEMO Secretariat has attended a number of virtual meetings and training with SEDEMA, CAFA, and PAHO. We have attended the National Health Security meeting, convened two meetings with the Office of the Prime Minister, and coordinating the NEMAC meeting, that is, and stakeholder meetings. Convened meetings with representatives of agency who would be coordinated response operation for the NEOC, that's the National Emergency Operations Center, when it is activated. So we are planning in the event that we have to get into action, meetings, planning with the national and district disaster committees, and the national committees like the supplies committees, like I mentioned before. We are also planning a meeting in the coming days with all the liaison officers. So what we have are liaison officers at all departments and ministries of government to guide them to ensure that the plan for the continuity of government is in place. Okay. We have developed the COVID preparedness and response plan. The plan was modeled after the national influenza plan. So the national influenza plan was tweaked to take in the unique characteristics of the COVID-19. We have advised the Cabinet on the declaration of an emergency, the disaster under the Emergency Act also, or the emergency or disaster under the Emergency Act, sorry. We have advised Cabinet on the national shutdown policy also. We have conducted public awareness training with the private sector on business continuity, and you'll understand why this is important. Yeah. So the businesses have their own plans in place and know when and after this all has passed, how they continue, how they get back on their feet.
Let me just ask for the businesses, are you getting calls from businesses on perhaps how do they even begin to institute this connectivity plan?
We are getting calls every day, every minute from businesses. Now, this started a while back. We have one training officer who has been working with the Chamber of Commerce. He just conducted a two-day training in the South. He had already done the North, and he just completed the South last Thursday. So there are calls from other sectors for that training in business continuity. That is ongoing.
Did you have to tweak that plan as well? Because perhaps now more businesses would have to look at their employees working from home. Yes. A concept that was not a very trendy one for St. Lucia and the Caribbean, while the rest of the world, that's the way it is really in most sectors. But so now our employers have to begin to consider this remote access to the workplace.
Yes, there's discussion with the NIC, and also they're looking at the labor laws as to how they can, at this moment, maybe suspend how the leave is done, the two-day non-certified leave, how they can extend that. Employers are fully aware, and they have been engaged on how severe this can get and how they should put the plans in place going forward. It's a new normal. It's a shift from what we know to be normal. So all sectors must get on board, and the thinking of working from home to take into consideration the social distancing, not having so many persons at work at once, working shifts. All of these have to be considered in order for us to manage, and managing this pandemic will decide how well we manage it, will decide how we come out of it. So we're encouraging all sectors to, your plans that you already have, if you don't have one already, start thinking of it and how you are going to activate working in your business from now on.
Before you continue, just want to ask quickly about the shutdown. I know that's one of the foremost things on the public's mind. At what point would the consideration for a shutdown be given?
We have seen how the delay in shutting down has affected countries. It's all over the news. And so, and we know the implications of shutting down. So there is talk about shutting down. As to the level of shutting down, I cannot say for now which one will kick in.
Which scenario
we can today get a call that there is in-country spread, and we must do what is necessary with a total shutdown. For now, we're looking at shutting down in phases, allowing supermarkets to continue, the banks, banking sector, the essential services to continue working for now, but on not as wide a scale as they do. So all of these things have people have to start thinking, if that happens, do I have everything in place? Have you met with your family and decide on a family plan? How you're going to handle this at home? Because it all boils down to personal responsibility. So government is doing what they should do, and believe me, they are not taking it lightly. Nothing is being taken lightly here, and every step is considered with people in mind. So with this, I encourage St. Lucians to take your personal responsibility. Ensure that your family is aware. At home, teach the children to wash their hands properly, how to do it, and they probably need to, the little ones need to probably play with an invisible friend for now.
I want to thank you so much there. We've been speaking with the Director of the National Emergency Management Organization, NEMO. She is Dorine Gustave, and you know that the workload is a heavy one. As she leaves here, there's a meeting that she has to attend to in order for us to be safe. Thank you so much. We'll take a quick break and we'll be back.
Thank you.
It's power bike time!
Oh, hey, you need to cover your mouth. Don't you know about the coronavirus?
It's not a joke, it's a serious thing.
True that. What's coronavirus anyway?
The coronavirus is a group of viruses that causes the common cold. In more severe cases, it's like the flu.
Really? So are you saying that this is not a new virus?
No, it isn't new. It's a new strain. That's why some people say novel coronavirus. Yes, look at it like a family who just had a new baby.
I get it now. So how is it spread?
Through the air, like coughing and sneezing, touching objects, surfaces with the virus on it, touching your face, your eyes, your nose, your mouth, before washing your hands with running water and soap.
Sounds like someone has the flu or the cold. Are the symptoms the same?
The symptoms are fever, coughing, sneezing, headaches, just like the flu. In some severe cases, you also have breathing difficulties and chest pains. Some persons also get pneumonia and kidney failure, and as you have heard the news, some people have died.
Wow. So how do I protect myself?
We have always been told to wash our hands with running water and soap. In the event there is no running water and soap, you use an alcohol-based hand sanitizer of at least 70% alcohol. Try your best to avoid touching your eyes, your nose, and your mouth. And in the event you need to sneeze and cough into a tissue, you throw the tissue into a bin. If you do not have tissue and you need to sneeze or cough, you do it into your elbow.
Yes, I heard that. So what medications can we take?
Well, as the virus is new, there is no medication or vaccine that you could really take to prevent it. What we really have to do is to practice infection control measures to protect ourselves.
Hey, people. I need to get a sweat. Let's get moving.
Let's do it, guys.
So, wait, how do I get more information?
Good, I have that number on lockpad. For further information, contact the Bureau of Health Education at 468-5349, 468-5347, or 468-5342. Let's defy limits! Woo! Come on!
Coverage live from the National Television Network, NTN, Government Information Service, the GIS. I am Lisa Joseph. I'm joined with my colleague, Primus Hutchinson. We'll take a look now and try to encapsulate for you some of the events surrounding coronavirus. And just to let you know that at the top of the hour at 8 o'clock, we did inform you that the Prime Minister, Honorable Alan Chastney, has tested negative for coronavirus. And I'll give you the official statement. On Tuesday, March 17, 2020, the Ministry of Health was informed that the Prime Minister, Honorable Alan Chastney, was experiencing a mild cough following recent travel history to Miami for medical attention, and in an abundance of caution, he had opted to place himself in voluntary quarantine. He contacted the Chief Medical Officer, and a medical team was dispatched to assess the Prime Minister. A sample was taken for testing, which included testing for COVID-19. The sample was sent to the Caribbean Public Health Agency, CARPHA, and the result was received late on the same day, that's the 17th of March, and it was negative for COVID-19. The Honorable Prime Minister has been informed of his results. He is in stable condition and in good spirits. And prior to receiving the results, the Ministry of Health had commenced the routine process of contact tracing. Some of the close Prime Minister's contacts also voluntarily placed themselves in quarantine as a precaution while they awaited the results. Along with the results for the Honorable Prime Minister, the Ministry of Health has also received other results for patients in isolation, and they are all negative. And we shall be providing a comprehensive update in a statement to the media, which will be released later today by the Chief Medical Officer. Now, the government of St. Lucia is continuing to intensify efforts at combating COVID-19, which is now a global pandemic. In a statement to the nation on Monday, 16 March 2020, Prime Minister Honorable Alan Chastney outlined the policy decisions already taken, as well as measures to come on stream in short order.
As of March 16, 2020, the Ministry of Health activated 3 respiratory clinics at the Viewfort Wellness Center, the Dennery Hospital, and the Grosley Polyclinic. An additional 2 clinics will be activated in the coming days to be located at the Leclerc Wellness Center and the Soufriere Hospital. These clinics are intended to take the care of persons who have respiratory infections. A hotline will be operational by the end of this week using 311 number, where citizens will be able to get information on the COVID-19. Mobile telephones will be made available from this week to physicians to provide medical advice via telephone consultation to persons with medical concerns with COVID-19.
And now, to facilitate this, the government of St. Lucia has received 40 cell phones from telecommunications provider Digicel. The Chief Medical Officer, Dr. Sharon Belmont George, explains how this process will work.
We will be utilizing our medical staff. We'll be using those phones with video capacity to provide information free of charge to the public who wants to speak directly with a physician. As you would imagine, during an outbreak of COVID-19, we will be asking people to stay home because 81% of persons who get it have mild disease. We would prefer if you stay at home if you have mild disease and to come out. We would not prefer for you not to get on a bus, not to drive. You'd further spread the disease. So you would have access to physicians that you can call and explain your concerns. Those physicians will be able to guide you as to, do you go to a respiratory clinic in the community closest to you? Do you go to the hospital? And advise you as to what to do, how to manage. So this will give the public an extra level of care. We have already received the phones and we will be distributing to our physicians who have volunteered to man those phones.
There, Sharon Belmont George. And a testing lab for COVID-19 is to be set up later this week following the training of the staff. Here's Fiona Neptune with that.
The nation's ability to diagnose COVID-19 cases will be enhanced as the Ezra Long Laboratory of the Victoria Hospital and OKEU Hospital recently received the equipment for testing of COVID-19. Director of the Ezra Long Laboratory, Dr. Wayne Felicia, says He is very pleased with the equipment for testing of COVID-19 and highlighted the benefits of this equipment for St. Lucians.
We purchased the Q32 as a form of increase in our diagnostic capacity for COVID-19. What we realized that from time of collecting the sample to time of getting the result is between 24 to 48 hours, since we've been using CAFA in Trinidad to give us our diagnosis. What we've actually done is purchase this equipment to reduce our turnaround time to a 3 to 4 hour period, which would improve our ability to treat and sift through which patients are actually positive for COVID-19.
Dr. Felicia also spoke on the efforts of the Department of Health and Wellness to ensure that the capability to conduct testing and diagnosis of COVID-19 is available at the soonest.
We forecast to having testing capabilities within the next 2 weeks. We actually in dialogue with our suppliers, Caribbean Diagnostics, who are now going to send somebody on island to conduct training, installation and validation, which will last a period of 5 to 7 days. And by then we should be able to have that capabilities.
Testing for COVID-19 is expected to be available during the week of March 23rd. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fiona Neptune.
And Prime Minister Honorable Alan Chastity, in his March 16 statement to the nation, announced that mass crowd events of more than 50 persons is now being discouraged. As a first step, the renowned St. Jazz Festival has been cancelled, all schools have been closed, and all school activities suspended. I spoke with Chief Education Officer Dr. Fiona Philip-Meyer on how the Department of Education, Innovation and Gender Relations is engaging students. The Department of Education, Innovation and Gender Relations, on the advice of the Ministry of Health and Wellness in light of COVID-19, has closed all schools on island. I am here now with Dr. Fiona Philip-Meyer, who is the Chief Education Officer, to give us some more insight into what it all means for the students and parents and teachers. Dr. Meyer, thank you so much for joining us.
My pleasure.
Since the closure of the schools, a lot has been said regarding how students will be able to carry on the rest of this school term, and we'll get to that in a moment. But let's talk about the sort of mobilization that has been happening at the ministry in the lead up to this decision.
Well, thank you for having me. We are keenly aware that this is not only a national issue, but it is also an international issue. And so we continue to take our cues from the Ministry of Health under the leadership of the Chief Medical Officer. For us, what we've been able to do is to look at this situation and recognize that it is a dynamic situation. It is quite fluid. We're not even sure what's going to happen in the next couple of weeks. So we have taken the proactive measure of closing all schools, as I said, under the advice of the Ministry of Health and the leadership of this country, to ensure that social distancing continues to happen. It is a situation whereby we appreciate that our younger students do not take all the hygienic practices as seriously as they should, but we continue to encourage them to do so. This proactive measure is in light of the fact that we do not want other members of the public and their families to be impacted. And similarly, we do not want our students impacted if there are issues in the school environment as well as the community.
And you mentioned the younger students. For the early childhood education subsector there, closures are also in effect.
Yes, for the early childhood sector, all of our early childhood centers have been closed. We have closed our primary, secondary, and tertiary institutions as well. It is a little different with our primary and secondary schools, where we engage our principals, our teachers, our staff members to provide instructional material for the students. We are aware that we're coming to the end of the second term, which is continuous assessment. But we're also aware and know the responsibility that we carry, and that all of our staff are supportive of helping the students in whatever way they can. So principals have been charged with the responsibility of continuing to offer packages for the students that can be picked up by their parents or another adult, so that the students can go home with particular bits of material that will help them continue their instruction. We're using various virtual platforms. The schools have Facebook pages. The Ministry of Education can do. We ask people to continue to look for educational programs run by our various national television stations, and to really support the students during this time when they, through no fault of their own, are at home but do need to continue their instruction.
And in the case where perhaps certain students may find difficulty in understanding some of the material, how can they interface with their teachers?
Well, for us, it is goodwill. We're really looking for a collaborative effort, and we know that many of our schools have already put various structures in place. There are WhatsApp groups that are coordinated and administered by our teachers and our principals, where we can disseminate information to our parents, where they can have a conversation with us as they have done in the past. It is to have that facility available, and we look for the goodwill of our teachers as we encourage the support to continue. It is not anything new. It has always happened. The last years we've had WhatsApp groups happening, and so this is a way to reach out with all stakeholders in a responsible manner.
I'm sure the pressure is on for the department to indicate how long past, because we know that the Easter period is going to come, which was the due vacation for students. But after that, I'm certain that people are eager to find out, parents are eager to find out, will school resume? And the answer from your department would be?
We are in uncertain times. This is a pandemic. We continue to follow the advice of the Ministry of Health, and they will guide us. We cannot make a pronouncement, and it would be also irresponsible of us to do so, to speak on what time frame we're looking at. Based on the information and feedback from that department, from the Ministry of Health, we will then continue to dialogue with our stakeholders and make a pronouncement at such time.
But it is important that parents ensure that students remain engaged.
Yes, and not only remain engaged, but also stay away from large social gatherings, to avoid moving into the city and to other parts. It is not a situation whereby this is another opportunity to go out and to go to the cinemas and to go to other activities. It is meant for students to be at home in the most safe environment, we hope, and we pray that with adults around them who can supervise them, that we will achieve this. I also want to mention the fact that we have a lot of websites that have been made available to our parents, to our guardians, and so continue to look at the Ministry of Education's website, the various Facebook pages of the schools, to really engage our students meaningfully.
I want to thank you there. We've been speaking with Dr. Fiona Philip Meyer, who is the Chief Education Officer, as she gave us an update coming from the Department of Education, Innovation and Gender Relations on the mitigation and management at this time that we're facing COVID-19. I'm Lisa Joseph. Thank you so much for watching. All right, then that was a pre-recorded interview there with Dr. Fiona Meyer, who is the Chief Medical Officer. Just also tell you that government has suspended all cruise ship calls. That started as of Monday, March 16, 2020, and that will be for the next 30 days. And all yachting and pleasure craft calls into St. Lucia have been suspended with immediate effect. Just to remind you, just in case you're just joining us, our special coverage live as the nation mitigates and manages COVID-19. The Prime Minister, Honorable Alan Chastney, we had been informed last evening that he had gone into quarantine, he had self-quarantined, And test results for COVID-19 have proven to be negative. And along with the results of for the Prime Minister, there were patients in isolation from in the region of 10, and tests conducted in them have all returned negative for COVID-19. Primus, some very good news there. I'm sure that the entire country is breathing a sigh of relief, because the concern was that perhaps the Prime Minister had fallen to COVID-19.
Certainly so, Lisa. I think we all a good sigh of relief in that regard. Monsieur Madame Colissa Deo, nous rapport connoté tant avant ça t'est venu officiel information de haka si moi j'ai tout côté qui prémisse là t'es malade avec mon t'es quoi qui PCT résultat des affaires maladie corona, mais quand nous deux tout à l'heure là qui la même te mettait isolé pour prendre précaution et que je te prends démarche vitement pour te adresser ça que vous test muté by CAFA qui vient même jour là et qui trouvé permis là parmi maladie pas jeune les pièces tout le monde qui était au moins il était pour faire conduire test ça sur aussi et pièce monde ça là parmi maladie non plus et ça c'est une bonne nouvelle tout bonnement pour nous en cette ci nous aussi c'est supposé nous préparer nous discuter et puis docteur Maya qui t'a parlé avec Lisa tout à l'heure là, nous aussi t'ai parlé encore avec docteur Maya que c'était direction qui ministre de l'éducation qui prend à Badjid, ministre de santé là venu pour l'école fermée et pour les étudiants qui caillent alors on entend comment les conversations ça va passer.
Eating or handling food or caring for infants, sick or elderly people.
Wash your hands. Wash them after.
Using the toilet, touching raw meat, handling pets and livestock, playing outdoors, cleaning or handling waste and garbage.
Wash your hands. Wash them often.
You are going right when you make a habit of washing your hands several times a day.
This message brought to you courtesy the Bureau of Health Education of the Ministry of Health and Wellness.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we say that? Chemicals and GMOs are not the solution. Use organic and join revolution.
Excessive agrochemical use, additives and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
Nous ici à Cabinet face au public discussion qu'on nous a fait toute semaine concernant maladie corona et que moi encore avec Lisa en anglais qui a information qu'on nous dit tout à l'heure là nous avons information sur condition premier ministre là qui était passé était fait l'examination concernant maladie avec toute bagage sorti négatif et aussi c'est mon qui était puis là nous tu parlé tout à l'heure puis madame Dorine Gustave qui c'est chef exécutif NEMO à son préparation et à faire comme ça nous à présent qu'à faire préparation pour ça nous tout à l'heure là concernant les discussions et puis encore et puis madame Fiona docteur Fiona qui chef officier d'éducation. Monsieur madame aujourd'hui nous avons une discussion spéciale comme ça ministre de santé j'ai pris une décision pour en collaboration avec le ministre de l'Éducation pour fermer toute l'école. Ça, c'est aux résultats de situation maladie corona. Et pour résoudre l'école déjà fermée. Et nous ici, ça c'est officier éducation. Ça c'est chef officier éducation au ministère de l'éducation. Ça c'est Dr. Fiona qui a discuté avec nous qualité de direction qui l'école là après on est mobilisé Mamaï di wattan sala. Merci et bienvenue à ce programme. Avant de commencer, encore félicitons pour tout vos rentrées éducation. Nous apprécions ça un peu. Ok. Qui direction qui au cas après ministre en situation ça là pour faire assurer que tout va marcher bien. Puisque maman l'école, ne pas à l'école dehors pour nous canaliser assez.
Oui. Well, merci pour l'invitation bon matin. À tout ça nous qu'a fait, nous pas qu'à faire par quoi nous seulement. Nous qu'a pris tout dit de nous Rod ministre santé avec nous qu'a toujours parler avec eux à ce qui ça qu'a fait avec qui ça a voulu nous faire. Nous savons si maman là yo pas l'école actuellement yo la caillou avec ça c'est pour garder comment nous ça point garde point précaution pour situation nous ni. Cette situation il a changé tous les jours. Mais nous décider pour ce maman là la caillou parce que nous savons jeune maman c'est pas toutes ces bagailles pour faire pareil toujours fait et nous ni plaisir jeune maman ensemble. So là la caillou avec yo supposé était la caillou avec parents yo avec l'autre monde qui responsable. So nous pas vle yo à chimère, nous pas vle yo tout partout comme marché ville Castries, nous vle yo la caillou. Mais c'est pour garder qui manière nous ça essayer ensemble pour garder comment ça qui affecte nous avec tout ça nous ça fait pour nous changer ça. Là nous garder qui ça nous a fait, nous a parlé avec différents membres qui travaillent avec nous, avec un département d'éducation pour garder. Différentes écoles, ils ont préparé, ça nous a créé packages pour ce moment-là aller la caillou avec. So, livre l'école, ils ont servi. C'est teacher qui dit côté yo teye, qui ça yo ça travaille à sous la caillou. Aussi, nous avons gardé sur Facebook, des fois mon Facebook page, c'est l'école là ni pour voir information by ce moment là. Pour voir différents bails ça fait, pas de temps yo la caillou. Nous avons gardé also à sous manière, nous avons servi quelques social media, WhatsApp. Même manière nous avons voir différents bagailles, mais nous ça aussi servi ça pour voir information by ses parents. Pour si on y a une question, si c'est l'école a toujours déjà fait ça, c'est pas rien neuf, c'est pas rien qui neuf. Plusieurs l'école ni WhatsApp group yo, les maman et papa ni anti question yo savoué. So en manière ça là, nous ka waiter et nous ka continuer pour faire ça nous responsable pour c'est pour dire ce maman là, supporter ce maman là. N'importe manière nous ça fait, nous ka essayer faire. Nous voulons aussi des parents pour regarder, pour précaution. Garder ça c'est maman la café. Parents aussi ni une responsabilité pour acheter bagay sur internet là qui bon, qui kay essayer pour encourager ce maman yo pour travailler en manière pour ça pour yo même ça point responsabilité pour dire qui ça moi veut faire, qui ça qui là. Nous kay garder télévision aussi, nous ni les différentes stations télévision qui jadi nous yo kay commencer à jouer plus bagaille qui kay bagaille éducation qui kay jeune maman là ça garder ça la journée avec l'année parent qui ça parle avec eux qui ça essayer pour expliquer qui ça qui a fait avec eux.
You know c'est bagala qui peut ni mettre sensible c'est maman là qui a cette l'école là ça est sensible moi ça yo kay c'est maman là léo à l'école là malgré les cas yo ka fait même ce bail là tout même bail là yo monter à l'école là là c'est pas on ka ni pour jouer un plus gros rôle pour ça les petit maman ça veut dire on fait qui c'est quoi
mais c'est plus petit ça nous ka early childhood yo tout kay wete la kay yo. Mwen vle ba exemple, le mwen te jeune, Sesame Street, qui sa nou te apprendre chaiti bagay asou se kalte program sa la. So nou vle encourager parents pour jwen ti manye, jwen ti video, jwen ti bagay, la li ti coloring books.
Di tablet apre.
Oui, yo di tablet, yo ka servi sa primaire parce c'est gwa moun aussi. Mais pour encourager yo pour garder bagay qui kay pas seulement pour yo just enjoy li avec assise là, mais yo kay apprendre en bagay. Avec nous vle ses parents parler ba isi maman là. Nous savons nous ni un gros problème à sous la nous, mais nous ni pour garder aussi qui ça nous ka disi maman là. Nous pas ça disi maman là simplement tout bagay mauvais, mais nous ni pour qu'on parents qu'on moun qui pli grand pour jide yo pour dire qui ça nous a fait qu'on ministre santé ka di nous laver la main nous commencer garder si nous pas te ka faire avant plusieurs fois par jour pour faire ces bagailles ça là comment nous ka marcher avec l'autre monde nous ka interacter avec l'autre monde so c'est qualité bagaille ça nous ka dit nous ja parler avec ça plusieurs fois mais à nous continuer avec à nous aussi garder qui côté information qu'a sorti nous ni yon seul côté pour nous prendre information ça là ça c'est ministre santé avec ces yo qui ka guide nous ka travailler ensemble avec yo pour nous garder qui manière nous as pep kay ça garder situation ça là et puis fait nous lever de matin pour nous dire nous j'ai fait tout ça nous te ça fait.
Nous apprécions ça tout bonnement docteur Maye avant nous finir qui nous a gardé qui joue l'école PV comment ça quand nous pas assurer nous pas ça c'est situation qui
Monsieur Hutchinson moi pas ça dire et moi pas ça parler avec ça parce que nous pas savent tous les jours des fois bagaille qu'a fait avec ça nous voulons faire nous voulons prendre toute d'idée nous toute advice nous sorti hod ministre santé avec là yo ça dit nous moi pas même ça si yo ça dit nous actuellement because nous sa situation toujours différent bail qu'a fait mais quand nous une information nous ça bail information pour toutes ces peuples là pour toutes ces parents savent qui ça qui a fait.
Docteur Maye encore merci autant pour venir ici pour discuter avec nous à faire ça là qualité l'intérieur qui va mettre en éducation avec maman en cette ici nous t'ai causé puis docteur Fiona Maye qui chef officier d'éducation ministre de l'éducation en cette ici concernant la situation maladie chronique l'école fermée qualité direction et qualité précaution qui est nécessaire pour ce maman qui a après ça merci autant.
Merci.
Ça c'était une discussion nous tenons et puis encore qu'on les s'était fait en anglais et puis chef officier d'éducation ministre de l'éducation c'est Dr Fiona Maye concernant préparation les étudiants et raison pour fermer l'école tout ça en manière pour adresser situation maladie corona cette ici c'est ça.
And thank you very much, Primus. And now this is where we come to the end of the first part of our live coverage as the nation staves off COVID-19. We will be back at 12 noon where we'll be hosting a press conference with the Acting Police Commissioner, Milton Daisy. That will be at 12 noon. You can tune in to NTN GIS for that. And just before we sign off, also to let you know that we'll also be live at 4 o'clock this afternoon, and we will be speaking with a member of the St. Lucia Medical and Dental Association. One of the notices for you, happening on Thursday, that's tomorrow, 19th March, is the National Day of Prayer, and the nation is being called upon to worship, give fellowship, and the National Television Network GIS again will be leading that, and stations will be joining NTN for that live coverage that's happening tomorrow, Thursday, 19th March, and it begins at 6 p.m. to 8 p.m. So we're having a 2-hour time slot there for persons to tune in, reflect, share, and participate in prayer. As I said, that's the end of our first segment for our live broadcast. We will be repeating this segment on the National Television Network. There are lots of information that was shared, so for persons who need to go over that information again with the director of NEMO, Dorine Gustave, you can tune in and listen very carefully on the repeat. And of course, for those of you on the social media platforms, Facebook and YouTube, you know it is there at your leisure. I'm Lisa Joseph along with Primus Hutchinson. We will see you back at 12 noon.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. Oh, think about the children. Think about the children. How will we say that? Chemicals and GMOs are not the solution. Use organic and join.
Excessive agrochemical use, additives, and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy, and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
As of March
Hello, St. Lucia and the rest of the world. Welcome to the National Television Network, the NTN, and the Government Information Service, the GIS. I am Lisa Joseph. At this time, we're beginning special reporting on COVID-19, the coronavirus that has gripped the world over. We will be with you throughout the day with special reports and speaking with various key members of the sectors that are working assiduously in protecting St. Lucia from COVID-19. To start off, we want to get to the results of the test conducted on Prime Minister, the Honorable Alan Chasney. Last evening, the nation was informed that the Prime Minister had gone into